Okay, so I mean, I guess one of the questions that I have is that like would that cover everything? Would that cover those people?
It absolutely would, because the fallacy that you see, and again, these are examples, and what we're trying to do here is we're trying to look at this problem so differently and so clearly and try and illuminate a whole different aspect of it that you don't hear from the Republicans, you don't hear from the Democrats. The insurance is being paid for today because everybody's paying for insurance. So the notion that it is impossible to do it has to be possible to do it because it's being done. The difference is that it's wasted. In the example that I'm using, if we really wanted to solve these 30 million people, sorry, that don't have insurance, just whatever the activities are that are going up the food chain, whether when I say that I mean an examination, a surgery, a hospital stay, et cetera, et cetera. Each one of those people performing those functions would take that function. So if a person was in the hospital for X number of days and the bill was $10,000, that hospital would pay $10,000 less at the end of their tax bill as a 100% tax credit, and that would be it. It would wash through the system because they're paying it now.
Now, if they're okay, so well, if they're writing off those taxes now, isn't that doesn't that money have to come from somewhere because now the government isn't getting that money, like from the patients or from tax revenue, like let's say the tax revenue on the doctors. I mean, isn't that going to essentially give them a huge tax credit that would probably bring a whole bunch of them into lower tax brackets, or wouldn't that be a net loss in terms of money to the government?
Well, that's what we want. We want a net loss to the number of money to the government, and we want a order of magnitude increase in the quality of service if in fact we really are trying to solve the 30 million people. Remember, we're just trying to solve the problem that there's 30 million people that don't have insurance. And so you have to presume that there's 300 million people in the country. So being the math major that I am, there's a 10% gap here of people that don't have it. But if you really wanted to do it, it's a very simple, straightforward way to solve the problem. And they would manage it just like they would manage any other ones. If they would not be necessarily encouraged to do more or less, they would treat them as they would a regular patient, and they'd be paid accordingly for it. Now, I guess theoretically, if 100% of your revenue came from tax credits, then you wouldn't be able to execute the tax credit because you wouldn't have anything to go against it. But I'm just coming up with a very simple, quick, easy to understand, incredibly easy to implement solution to a problem that I don't even personally think is a problem, and I've never heard yet a justification for why it is. But even if it was, there's an answer for it. Did you ever hear anything like that from Republicans or Democrats?
No,
No,
no, nothing. I mean,
no.
basically, it's a question of which type of tax are you going to get? I mean, sometimes you'll get some small tax credits maybe on one side. Maybe the Democrats will put some tax credits for like lower income people, depending on your relationship to the federal poverty level. But it seems like you get either taxed one way well, it's a question of how do you like your tax on each side, as opposed to one side saying we really don't need taxes to solve this issue, and another side saying yes we do. We basically are getting taxes on each side.
Okay, so let's use that kind of as a launching point and say, in addition to the 30 million people, because I really believe if you sincerely wanted to solve that problem, it's solved. You can implement that and it's solved. So let's take it now to the next step and say, well, what would the medical field look like in a rational society? What if we had a rational implementation of a healthcare system? What would it look like, and what are the key components of that are really causing the spectacle that you see unfolding in front of you today? The first one is regulation. People have to understand that every time Washington gets involved in these industries, just the bureaucracy that they bring to the table, and in this case in the medical field, it's close to 50% of the costs.
50.
So if you wanted, yes, 50. If you wanted to cut the medical business in half, in terms of the actual cost that the patient pays, all you have to do is get the bureaucrats out of the equation. So that would be the biggest most obvious one. And to give you some idea as to once these bureaucratic organizations get in there, how they bloat and how they manifest themselves and how they turn into these, monsters, if you will, that just eat the entire industry alive. In the late 80s, the healthcare as a percentage of gross national product was approximately 4%.
Okay, yeah, it's significantly higher now. It's about 16% now.
So there you go. So in a 15-year period, it's gone up 400%, and soon to be dramatically greater now that they passed that legislation. So right there is one area. That's regulation, okay? The next one is insurance. Now here you've got a couple different aspects. And again, why aren't we hearing this from particularly the Republicans? Because I think the Democrats are pretty much in unison, lockstep, that they just want to make this, as communist a country as possible. So they're not really going to come up with any solutions. But if the Republicans, there's any shred of rationality left in the Republican Party, these would be areas that I would feel that they should go after. And insurance companies are certainly the number one area, and probably the easiest one, because they are protected. They're a protected cartel. Therefore, they have limited competition. And if you opened up that competition, just the forces of competition will drive prices down, will drive innovation, will drive efficiencies.
Okay.
The second thing is
why do you call them cartels?
Because the only way, if you and I want to get in the insurance business tomorrow, we can't do it.
Okay,
if we want to get in the hamburger business tomorrow, if we want to open up a car wash or a hamburger restaurant stand, or pick whatever you want, local corner store, we can do that, and we can open up multiple ones, and we can have a good business. But we don't have that ability in protected industries like banking, insurance, etc. And so you can do it, but in order to do it, you have to go through so much red tape. You end up paying off the politicians and et cetera, and blocking and protecting. That's why you see this insurance that doesn't work across all the countries. All the states across the country. I mean, how absurd is that?
Right. I mean, you can buy.
Could you imagine going to McDonald's and getting, an Indiana version of a Big Mac as opposed to a Massachusetts version of a Big Mac? I mean, that would be crazy.
Right.
I mean, you'd lose the economies of scale, you'd lose the quality control, et cetera, et cetera. Well, same thing there. So
which is what we've lost.
Exactly. So just right there is one. The second one is the behavior of the customer has been shaped through insurance, because they create this fallacy that you're going to get something for nothing. And I'm sorry, in reality, if you want to live in reality, there is no such thing as getting something for nothing. Someone at some point at the end gets stuck with the Ponzi scheme. So you can't have customers whose behavior is shaped to think, well, geez, I have this, elaborate procedure that's going to cost $1,200, and I need to go to the doctor to get it, whatever it is, addressed, and I'm willing to make a $15 copay. Someone at some point carries that and gets stuck with that at the end of the line. And so not only does it create just a completely non-value attitude towards the products, because you don't value anything. If I can get a $600 or $1,200 procedure for $15, I'm not going to value it. So I'm going to what? I'm going to abuse it. Right. That's why you see people that go to the emergency room because they got a sore throat or whatever. I mean, it's ridiculous. But it also creates what I call a pig trough mentality. So now everybody knows that if they can just, weasel into the pig trough and get their nose in there, they can eat as fast as they can for $15. It's like, then some way, somehow, magically, that problem goes away. But they're in there just with no reason whatsoever to curtail the use or ration the use or properly apply the use of these services, and that puts an additional burden on the system. So that would be another area.
Right, because that's all they see. They see the small charge, $10, $20, $30, and say, okay, who cares?
Right, and yet when their car is broken or their car needs to be repaired, they don't, because their behavior hasn't been shaped. Everybody knows if you're at your 3,000 miles or whatever it is you go, and you need to go get your oil change, you can clearly go down to the local place and pay $20 or $30 and get your oil changed. Okay, but when it comes to the 30,000 mile tune-up, and you have to get the tires rotated or replaced, and you have to get the fluids and the